Vemurafenib, also known as Zelboraf, is a medication used to treat melanoma, a type of skin cancer, and Erdheim-Chester disease, a rare type of blood cell cancer. These cancers have a specific abnormal BRAF gene, and Zelboraf works by slowing the growth of certain cancer cells. It falls under the class of drugs called kinase inhibitors. The recommended dosage of Zelboraf is usually taken twice a day, and it is important to take it at the same times each day. It can be taken with or without food, but it is important to follow the dosing schedule recommended by your doctor. Before you start taking Zelboraf, make sure to read the medication guide provided by your pharmacist. Take this medication by mouth with or without food as directed by your doctor, usually twice daily about 12 hours apart. Swallow whole with a glass of water. Do not crush or chew this medication. If you vomit after taking your dose, do not take an extra dose of this medication. Take the next dose of the medication at the regularly scheduled time. The dosage is based on your medical condition, response to treatment, and other medications you may be taking. Be sure to tell your doctor and pharmacist about all the products you use, including prescription drugs, non-prescription drugs, and herbal products. Do not increase your dose or use this drug more often or for longer than prescribed. Take this medication regularly to get the most benefit from it. To help you remember, take it at the same times each day. Tell your doctor if your condition lasts or gets worse. Since this drug can be absorbed through the skin and lungs and may harm an unborn baby, women who are pregnant or who may become pregnant should not handle this medication or breathe the dust from the tablets. Some of the common side effects of Zelboraf include hair loss, dry skin, headache, nausea, vomiting, diarrhea, and swelling of ankles/feet/hands. If you experience any of these effects, make sure to inform your doctor or pharmacist. It's important to remember that your doctor has prescribed this medication because they have determined that the benefits outweigh the potential risks. Many people using Zelboraf do not experience serious side effects. It's also important to be aware that Zelboraf may cause other types of skin cancer, such as cutaneous squamous cell carcinoma and melanoma. If you notice any changes in your skin, such as new warts, skin sores, or changes in the size/color of moles, make sure to inform your doctor right away. In rare cases, Zelboraf may also cause or worsen other types of cancer, such as non-cutaneous squamous cell carcinomas of the head and neck, or cancers with RAS mutations. If you experience any very serious side effects, such as eye pain/swelling/redness, vision changes, fast/irregular heartbeat, severe dizziness, fainting, liver problems, trouble swallowing, heartburn, or signs of kidney problems, seek medical help immediately. Zelboraf can commonly cause a rash, but it's important to inform your doctor if you develop any rash, as it may be a sign of a severe reaction. Additionally, seek medical help right away if you notice any symptoms of a serious allergic reaction, such as fever, swollen lymph nodes, rash, itching/swelling, severe dizziness, or trouble breathing. Remember that this is not a complete list of possible side effects, so make sure to contact your doctor or pharmacist if you notice any other effects not listed here. Before taking Zelboraf, make sure to inform your doctor or pharmacist about any allergies you may have, as this medication may contain inactive ingredients that could cause allergic reactions. It's also important to discuss your medical history, especially if you have undergone radiation therapy. Zelboraf may affect the rhythm of your heart, potentially causing serious symptoms that require immediate medical attention. The risk of this condition, called QT prolongation, may be increased if you have certain medical conditions or are taking other drugs that can also cause QT prolongation. It's crucial to inform your doctor about all the medications you are taking and any existing heart problems you may have. Additionally, low levels of potassium or magnesium in your blood may also increase the risk of QT prolongation. It's important to discuss this with your doctor, especially if you are taking certain medications or have conditions such as severe sweating, diarrhea, or vomiting. It's essential to limit your time in the sun while taking Zelboraf, as this medication can make you more sensitive to sunlight. Using sunscreen and protective clothing when outdoors is recommended, and it's important to notify your doctor if you experience sunburn or skin irritation. Before undergoing any surgical procedures, it's important to inform your doctor about all the medications you are using, including prescription drugs, non-prescription drugs, and herbal products. If you are an older adult, you may be more sensitive to the side effects of Zelboraf, especially skin changes, nausea, decreased appetite, swelling of ankles/feet/hands, and QT prolongation. If you are pregnant or planning to become pregnant, it's important to discuss reliable forms of birth control with your doctor while using Zelboraf, as this medication may harm an unborn baby. If you become pregnant while using Zelboraf, it's important to speak with your doctor about the risks and benefits of continuing the medication. It's unknown whether Zelboraf passes into breast milk, so it's recommended to consult with your doctor before breastfeeding while using this medication and for 2 weeks after stopping treatment. It's important to be aware of potential drug interactions that could affect how Zelboraf works in your body and increase your risk of serious side effects. Make sure to keep a list of all the medications and herbal products you use and share it with your doctor and pharmacist. Do not make any changes to your medication without consulting your doctor. One drug that may interact with Zelboraf is ipilimumab. Additionally, there are many other drugs that can affect the heart rhythm and the removal of Zelboraf from your body, potentially impacting its effectiveness. These include certain antibiotics, antifungals, HIV protease inhibitors, and other medications. It's important to be aware of these potential interactions and discuss them with your healthcare provider. When taking Zelboraf, it's important to be cautious of other medications that can be affected by it, such as caffeine and warfarin. Be sure to talk to your doctor about any concerns you may have and follow their guidance on the best timing and dosage for taking Zelboraf. If someone has taken too much Zelboraf and is experiencing severe symptoms like fainting or difficulty breathing, it's important to seek immediate medical help. In the U.S., you can call your local poison control center at 1-800-222-1222. Canadian residents can call a provincial poison control center. It is important not to share Zelboraf with others. Before starting this medication, you will need to undergo certain lab and/or medical tests, such as BRAF testing, liver function tests, kidney function tests, EKG, and blood mineral levels. It is crucial to keep all your appointments, as regular skin exams, such as every 2 months, will be necessary while taking Zelboraf and for up to 6 months after stopping treatment with Vemurafenib. Be sure to consult your doctor for more details. If you forget to take a dose of Zelboraf, take it as soon as you remember. If it's within 4 hours of your next scheduled dose, then it's best to just skip the missed dose. Don't take a double dose to make up for the missed one. Just take your next dose at the regular time. Always follow your doctor's instructions on when and how to take this medication. When it comes to storing Zelboraf, it's important to keep it at room temperature in its original container, away from light and moisture. Make sure to store it in a safe place that's out of reach of children and pets. And when you no longer need it or it's expired, be sure to dispose of it properly. It's best to consult your pharmacist or local waste disposal company for guidance on how to do this. Remember, don't flush it down the toilet or pour it into a drain unless specifically instructed to do so. If you need more help, call your doctor for medical advice. In the US, you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.